While unfunded public pensions have grabbed the lion's share of the headlines recently, here in Warwick, the unfunded health care benefit liability is a much bigger problem, to the tune of more than $300 million. Part of the problem? Promises made years ago to give many retired employees lifetime health benefits, including some city council members. Warwick is one of a handful of communities that offers city council members medical coverage. All but one of the 9-member council take it. 7 have family plans. And up until last year, if you served 3 consecutive terms on the council or as mayor, you qualified for lifetime health benefits. That's 6 years for lifetime health coverage. That means taxpayers this year are paying for 16 former councilmen, mayors, or their widows to the tune of more than $50,000. Because Warwick is self-insured, all claims are eventually billed directly to the city. Among the dozen-plus receiving the coverage, former city councilman Mike Brophy, Carlo Pizzatoro, and Jerry Goldstein, and former mayors Charles Donovan and Eugene McCaffrey.
My name is Frank Flaherty.
The Hummel report also found that former mayor and current Supreme Court Justice Frank Flaherty receives the largest benefit of all, a Blue Cross family plan that cost the city more than $16,000 in premiums alone this year. Flaherty also receives a $20,000 a year pension for his time in the city solicitor's office as a councilman and mayor. Flaherty pays nothing toward his medical coverage. Justice Flaherty is eligible to receive health coverage from the state, but it requires a 25% copay on the premiums. He receives a $2,000 bonus for not taking the state medical coverage. We requested through a court spokesman to interview Flaherty about his benefits and ask whether he would consider paying a co-share on the premiums as the current council members now do. Flaherty declined our request, but said through the spokesman that his benefits, quote, reflect 21 years of service to the city, benefits that are all a matter of public record and provided under the law. While Flaherty had nearly 2 decades of service to the city, others getting the lifetime medical coverage have much less. 6 years and be able to get lifetime, that's a big cost to the city, isn't it not?
I don't think we can afford it anymore.
Yeah.
And that's why it's not going to happen.
Council President Bruce Place says the council last year voted to eliminate the lifetime benefit for elected officials, saying it is a move toward reining in the city's obligations on health care costs across the board.
Absolutely, it's one of the highest costs that we incur, especially with retirees. But I firmly believe that people that were hired by this city 20 years ago and retired, you don't change the rules on them in the middle of it. So you got to be proactive and think ahead. You got to think about new contracts in the future, what you sign and what you don't sign, and we just can't afford those kind of benefits in the future.
But what about benefits for current city council members? Employees of the city must work more than 20 hours a week to get the same benefit. But council members don't punch a clock, so it's difficult to quantify how many hours they actually put in. What is clear? The Blue Cross plan they receive is one of the best available. The council members now pay at least a 10% co-share. Some volunteer to pay more.
It's not an issue for any of my constituents.
Really?
What I hear from people, and just is that what they see me doing is they see me out all the time. They see me working really hard. And I had a lady the other day just say, thank you, because I wouldn't want to do it.
Steve Colantuono will be the last councilman eligible to receive the lifetime medical benefits if he serves 3 terms, since the ordinance eliminating them was passed after he took office in January 2009. His fellow council members amended the ordinance that would have excluded him from the lifetime coverage.
Now, the benefit is a great benefit, don't get me wrong. It's not that I work my butt off for the benefit. I didn't even know we got benefits until I was on the council and we started talking about those kinds of things. Didn't run for the benefits. Love to have them. It's great. And I put in my hours and I do what I need to do. But, if the benefits weren't there, I'd move on. My wife and I would find another way to move on and get benefits too.
But the premiums are only part of the real cost of the benefit to the city and its taxpayers. The Hummel report has learned that last year the claims against the city's policy for the current council were more than $250,000.
It certainly is a big number. I would be surprised, but I know that there have been some issues. with folks as far as the claims and the usage of the insurance, and I know that's how it's all based.
And I'm wondering whether that gives you pause at all about the benefit.
It absolutely does. It's like I said, it's a benefit that we all appreciate. You never know when you're going to need it or when you're going to use it to that degree.
The mayor has the power to eliminate the medical coverage for city council members, but so far has not invoked that executive order. In Warwick, Jim Hummel for the Hummel Report.